And welcome back to Take Charge of Your Health. This is Dr. Wolf, your host. Great to have you back with us. For our regular customers, you know why you're here. This is your 1 hour a week where we help you do your healthcare homework. For our new listeners, welcome to the show. Take Charge of Your Health delivers the latest medical information you need to make the best health decisions for you and your family. And we've got a great example of that this evening. We have two guests in with us at the studio, as well as our usual crew. Are sitting across from me, Dr. Amy Sternstein, who is professor of pediatrics at Ohio State University and coordinator of the Ounce of Prevention program at Nationwide Children's Hospital Center in Columbus. And we are going to talk about overweight kids. Also with us, Dr. Jay Rissover, who's putting a plug in for the 8th annual Chicken Soup Cook-Off. Dr. Rissover is an internist with Blue Ash Internal Medicine. And our regulars, Denise, who's the glue that holds everything together, Denise Gardner, RN. To my left, Dr. Leslie Dye, who's a toxicologist and fills in for me when I'm out of town. And also Dr. Bill Schneeberger, my associate, and cardiac surgeon and the person who knows everything about South Africa and particularly South African wines. So we have a great program for you tonight. The way we can get into this is explain to you that the big picture was the obesity epidemic was recognized by the state of Ohio. And the state of Ohio got some money to try to figure out how to control this obesity epidemic. And one of the people who's been instrumental in that program is Dr. Sternstein. Amy, welcome to the program.
Thank you for the invitation.
You are the coordinator of the Ounce of Prevention program at Nationwide Children's Hospital Center in Columbus. But more than that, you've been instrumental in teaching pediatricians around the state of Ohio, and now I understand also in other states, how to approach childhood obesity.
Well, I have been fortunate because I play many roles. I also take care of medical management of children that are overweight. But as I've done that on a day-to-day basis, one person at a time, I recognize that it was very important to also share the information I was learning with other pediatricians around the state. So I was fortunate enough to partner up with the Ohio Department of Health, as well as the Dairy Council and the Academy of Pediatrics. And we've designed a program so we can go and distribute very important nutrition and physical activity information for pediatricians throughout the state.
So your job, one of your jobs, is to teach pediatricians around the state how to recognize the potentially or the already obese child, correct?
That's correct. The best indicator for obesity is something called a BMI, which stands for Body Mass Index, and the accuracy of that is evident at age 2. Prior to that, you can look at the height per weight percentile on children. But most importantly, prevention is really the key. I've been in pediatrics for 20 years now, and it's very difficult to treat overweight once people are in that state with other medical problems. So my focus and my passion was in prevention, particularly looking at the first 6 years of life.
So let's say you're a grandfather. You notice that your son's 2-year-old is looking pretty portly, and you're a little bit worried about that. But maybe he just eats well. But how does a pediatrician supposed to figure out if someone's going to be in trouble? And you're starting out very early. I mean, how early are you looking at kids to see if maybe they're going to develop into someone who's going to be obese?
Well, you've asked me two questions. Yeah. I'm going to address the second question first. How early? And I have to say that we look at infancy. In fact, we're looking at the prenatal state of the mother. For mothers who are overweight prior to pregnancy and gaining more weight during pregnancy, there are some risk factors for that child even before birth. So it's incredible, but my particular program, Ounce of Prevention, is targeting the newborns, and it's never too early to look at obesity prevention. The first question you asked had to do with how we can really identify what to do with that 2-year-old who the grandparent is worried about. I think the most important thing to remember is that all parents and grandparents are very well intended. So if they are taking their child out to fast food or they're making sure they get a good cupcake during birthday celebrations, they're not doing it because they are concerned about their weight. They're doing it because they actually feel that they're doing the right thing for the child. So it's a very sensitive topic, and it's something that you have to address very delicately. But as a 2-year-old, that child hopefully has a primary care provider, either a nurse practitioner, pediatrician, family practitioner. And so they have been going in for well child visits, and they're getting their height and their weight checked and even head circumference in the young age. So you can get a good sense of their growth even as early as the first year of life. So it's something that should be discussed with the pediatrician or the primary care provider.
So what have you found when you've gone out around the state and talked with pediatricians? Was this something that wasn't routinely being done, and that's why you started the ounce of prevention? Were these kids being missed by the primary care or pediatrician?
I can't say that these children were being missed, but really within the last 6 or 7 years, there's been much more acknowledgement of how severe the obesity crisis is within children, and most notably in the young children. The Center for Disease Control just came out with some research in 2011, and they stated that 10% of 2 to 5-year-olds are now considered overweight. That's not obese. So what the ounce of prevention provided was the information and the knowledge base for the pediatrician to then counsel on nutrition. Because a lot of pediatricians, unfortunately, during their training don't necessarily know as much as they could know about nutrition.
So you provide them with some numbers. If the child is greater than this weight or some certain numbers that allow them then to kick into action certain things. Is that right?
I think it's better to view it as nutrition education and physical activity education. When you take your 2-year-old to the doctor for their checkup, what doctors do typically is they do something called anticipatory guidance. They look at where you are developmentally. So what is a 2-year-old doing? How well are they feeding themselves? How well are they toilet training? And part of that is also what is their diet? What is their sleep pattern? How active are they? So we generally ask all the questions that keep a person healthy and well, and so weight has to be part of that discussion. And what I want the pediatricians to feel comfortable doing is if the parent asks what is the appropriate diet for a 2-year-old, I want them to feel comfortable that they have that knowledge base.
If you'd like to join us, we're at 749-5500. We're talking about childhood obesity. And Amy, this is up all the way to age 16, 18? Or?
18. We started our program just looking at birth to 6 years, and the feedback was so positive that in 2010, we expanded our age group all the way to 18.
So if you have a question about your son or daughter or grandson or granddaughter, call us at 749-5500 and you talk to Dr. Sternstein. If you're outside the area, 800-823-TALK. That's 800-823-8255. We'll be back in a minute. This is Take Charge of Your Health, 55 KRC, the talk station. And welcome back to Take Charge of Your Health. This is Dr. Wolf, your host, and we have Dr. Amy Sternstein, professor of pediatrics at Ohio State University. We're talking about obesity, childhood obesity, which we just heard is from age 0 up to 18. We're going to take a call from Therese in Anderson Township. Therese, this is Dr. Wolf. How can we help you?
I'm just curious what your opinion would be about a baby who's strictly breastfed, nothing else but breast milk, who becomes rather obese. And then when he was 3 years old, he was diagnosed with type 1 diabetes. Do you believe there's a correlation?
Dr. Sternstein, you want to take that call?
Well, first of all, I encourage breastfeeding. And in fact, we really encourage mothers to exclusively breastfeed and for the first 6 months at least. But type 1 diabetes may in fact have more of a genetic basis. That's pretty unusual and quite young for the onset of the diagnosis. But I don't believe there's any correlation with the breastfeeding.
I'm very glad to hear that, because the pediatrician that she has kind of led her on a guilt trip, and I always said there's really no correlation. But I was just glad to hear you say that.
Well, we always like a happy caller. That's
Well,
great.
yeah. Well, thank
right.
you for the call, and I support her in her endeavors. That's a challenge.
Yes, thank you for your time.
Oh, thanks for listening. I guess we ought to mention what BMI is. I know this is a little bit boring, and we don't want to get into too much detail, but that's something that your pediatrician looks at, BMI. Amy, you want to describe that sort of in lay terms so
Sure.
our audience understands that term?
I do want to say that there is a distinction between how you use a BMI for a child versus how you use it for an adult. But the calculation is the same, and the way you figure out what the BMI is essentially you just take the weight in pounds and then you divide it by the height in centimeters squared and multiply that by 703. You will get an absolute number. For instance, you may get a number of 35. That would be the BMI that they would use for the adult classification. But children are different because their growth rates change over time. So we use what's called a BMI percentile. So that number of 35 or 34 would then be plotted on a graph, and then you could see what the percentile is based on the child's sex and the child's age. But a real easy way, if you're interested in finding out how to do a BMI, is the CDC has a website. It's www.cdc.gov. And there you just put in your height and your weight, and it does all the calculation for you.
Yeah, and so the basic idea here is if you have a child and their weight's a little high, you want to correct because maybe they're also very tall. So if they're very tall and they weigh a little bit more, they may still be okay on BMI. And just the opposite, if their weight looks pretty good, but they're really short, they still may be a little bit overweight, correct? It corrects for the height.
Yes, it really looks at your proportions. But I have to say that children in the first 2 years of life may have a relatively high BMI. Typically people like a chubby-looking, healthy-looking child. But as they go through their preschool years, typically that BMI will naturally drop because they're more physically active. They're usually less interested in food. In fact, you all know who have toddlers. It's difficult to have them finish their meal typically. So they're not interested in eating, and so it's really normal for their fat percentage to drop. The lowest BMI that you expect to see is at age 4. So part of the counseling I do for pediatricians is I tell them, please check the BMI, because if you do not see the drop in the BMI during the preschool years, that's a child who needs to be identified, and counseling needs to start right then.
If you'd like to join us, you have a question about childhood obesity as from 0 to 18 years old, this is your opportunity. We have Dr. Sternstein in the studio, 749-5500 or 800-823-TALK. And Denise is manning the internet. You can go to Dr. Wolf's TakeChargeOfYourHealth.com if you're shy and don't want to talk to us on the phone. Dr. Jay Rissover is kind enough to come down and join us in the studio, and he's here primarily for a plug, but we're always happy to see Jay. Dr. Rissover is with Blue Ash Internist. This is the 8th year of the annual Chicken Soup Cook-Off. Dr. Rissover, welcome to the show, and give us a full report.
Thank you so much, Dr. Wolf. Actually, I have a question for Dr. Sternstein, but I do want to talk about chicken soup. So
we can do both. That's fine.
We'll
Sure.
do that first, perhaps, because after all, what's more important, childhood health or a good time? Well, actually, that's not a good question. But let me tell you about the good time that I would like to invite you and all your listeners to have on Sunday, January 29th.
So a week from today.
A week from today. From 12:15 to 2:15, we will have over 32 different types of soup for you to all sample for one low price of $6 per person. The money goes to charity. It's at the Wise Temple. I'll give you the address in a moment. But it's just a wonderful, wonderful time. We have hundreds of people that come. We have auction items. We have live music. But it's really almost a gourmet event centered around a really comfort food, a really great comfort food, and that is, of course, chicken soup.
But you have more than chicken soup there as well, right?
Well, actually, we do have desserts, we have drinks, we have live music, auction items, we have some celebrities. In fact, those who listen to WKRC will have Brian Thomas from this station. But I would like to talk a little bit about the soup, because really we have a contest, and we give out trophies for the best chicken soup in Cincinnati. This is our 8th year running, and we have many restaurants that vie for that coveted title of best chicken soup in Cincinnati. For example, this year, McAllister's Deli, which I believe actually has won in the past, is entering again. Very good restaurant. Bravo's in Deerfield, Parker's Blue Ash Tavern, the Stone Creek Dining Company, Marx's Hot Bagels, the Apple Tree Cafe, Kroger's, of course, who's a major sponsor of ours. They're entering 3 different soups. The Jewish Hospital is a sponsor. They're entering soup from their cafeteria. Now, some of you may think that hospital soup may not be good, but I tell you, they've really been working on this. It sounds like it's going to be fantastic. Izzy's
It's Jewish hospital. It's got to be good.
That's correct.
But it's owned by Mercy now.
Okay.
So Izzy's will be entering their soup. Rascals also probably has an in there on the Jewish soup. In Cahoots is entering soup. Brown Dog Cafe has had these wonderful exotic soups in the past. They're coming again. Aladdin's Eatery has a wonderful soup. The Firehouse Grill, first time for them. We're thrilled to have them. Barisi's Restaurant, another great place that has entered in the past. And another first time, Costco, which apparently they have all this rotisserie chicken and they tend to turn it into soup. So we have a lot of great soup, not even counting our 14 amateurs are going to be entering soup. It's a grand, glorious time. For $6, you have samples. Usually it's really almost impossible to have 34 different types of soup. We have little tiny cups. You take little tiny sips. You can do it, but it takes some work. And then we have all the Marx's bagels you can eat for this price. Marx's great bagel place, known for years. We have hundreds and hundreds of bagels. And we have even some nice, healthy vegetable trays. So I know Dr. Sternstein will be happy about that. She probably want to send children here so they have their nice vegetables. They have some soup and maybe a little bit of a bagel, right? That'd probably be okay, correct?
Yes.
If I were a chicken in Cincinnati right now, I'd get out of town.
That you probably should do.
You don't check BMIs there, right?
No, we do not.
Good.
But this is mostly healthy, except for the desserts, which I won't mention, the chocolate cake. Some people seem to need a little bit of something to go with that. But, I'm an internist. I do like to promote the healthy aspects of this.
So again, Jay, this is a week from today.
Correct.
12:15 to 2 p.m. Give us the rest of the details.
Sure. It's at the Isaac M. Wise Temple at 8329 Ridge Road. Actually, if you have any questions at all, we have a website, chickensoupcookoff.org. www.chickensoupcookoff, all one word, .org. Get all the information there, and we'd love to have you. We actually have 2 shuttle buses for parking. We've had parking overflow issues, and we found we've been able to settle it. The JCC is nearby on Ridge Road. You'll see signs. If you get off the Ridge Road exit off Ronald Reagan Highway, you will see signs directing you to parking and the shuttle buses. The shuttle buses are free, and it's just a grand, glorious time. We have great auction items. I do want to thank Kroger and Jewish Hospital, our big sponsors. They make it all possible, plus Huntington Bank, Vitas Hospice, and Marx's Bagels, Ulmer and Byrne Law Firm, and Dr. Dale Horn, River Hills Neurosurgery, and the Urology Group, all of whom help us bring all this to you.
This has become a pretty big event. I just got one simple question.
Yes.
How to get started?
It's a long story. I started it 8 years ago with a lot of help. I mean, the Brotherhood does this. It takes dozens and dozens of volunteers working 6 months every year to get this thing off the ground. But basically, I'd heard about the idea at another place, and I said, wow, I really want to go to that event. I want to go to a chicken soup cook-off. I want to taste different soups. That sounds like a lot of fun. And nobody wanted to do it. So I did it. And it has been a lot of fun.
But you've built it up into a pretty big deal.
We had over 1,000 people last year. We're hoping for more this year.
And so pretty much guaranteed you'll get enough to eat if you go there.
Guaranteed. I have pictures of people just laying back covered in cups and just, with this smile on their face. They can't eat anymore.
I guess it's supposed to be pretty healthy for you too, right?
I'm hoping so. A lot of chicken, a lot of vegetables, little bagels. Yes.
But you've researched chicken soup before, I know.
Oh yes, I have.
There's healthy aspects to it.
Yeah. Sadly, there's only 2 published studies on chicken soup. And one is on the chemotaxis of neutrophils and how it's inhibited by a factor in chicken soup.
We'll pretend you didn't say that, but go ahead.
The other study is on nasal mucus velocity in chicken soup. That one's even worse. So maybe we'll talk about those sometime, but you have to have a strong stomach to talk about that. But chicken soup, you don't need a strong stomach. Come and have it. We also have auction items. We'll have Reds tickets, Bengals tickets. We have art objects, memorabilia, and the bidding starts pretty much at $0 or $5, so you get some really great deals there too. We have a commemorative hockey stick. We have signed baseballs from the Reds, and just all kinds of interesting items.
That sounds good. Why don't you stick around with us a little bit? If you're an internist, so you deal with obesity as well, I'm sure.
And I do.
And I imagine that you would be very pleased to hear that pediatricians are trying to identify patients before it's time for them to come to the internist, which I imagine your practice is limited to people that are over 18.
Well,
right?
not exactly. I actually start around 14 to 15, and I was going to ask Dr. Sternstein when I have such people come into my office. Actually, I have the troubles with obesity. I would very much like the pediatricians to fix it before it comes to me. That would be good. Then I'd have nothing to do, but that's okay. I'll figure out something else. But when I have a young person and they come and I either do a BMI, I do BMIs in my adults. I must admit I haven't adjusted them for my children, but generally I choose children who are beginning to have adult stature. And I tell them, I look at them and I can see that they're beginning obese, or perhaps they are obese. They're certainly overweight. And so I tell them, yes, you need to increase your activity. You need to increase your exercise. It would be good to reduce your calorie intake. But how do I talk to a 14-year-old and 15-year-old? How do I actually impact on a 16-year-old to do that?
Well, I'll tell you what, that's a good question to come back with. If you'd like to join us, we're at 749-5500, 800-823-TALK, or Dr. Wolf's TakeChargeOfYourHealth.com for questions. When we come back, we'll ask Dr. Sternstein to answer that question. This is Take Charge of Your Health on 55 KRC, the talk station. And welcome back to Take Charge of Your Health. This is Dr. Wolf, your host. And if you'd like to join us, 749-5500. If you're out of the area, and I know some of our listeners are all the way out to the West Coast, 800-823-TALK, 800-823-TALK, or 749-5500. And our guest here in the studio, Dr. Amy Sternstein, who's professor of pediatrics at Ohio State University. She received her medical degree from the University of Virginia School of Medicine, and she did a residency right here in Cincinnati at Cincinnati Children's. And she is the coordinator of the Ounce of Prevention program at Nationwide Children's Hospital in Columbus, and has started a program to teach pediatricians around the state on how to identify children at risk for obesity, sort of nip it in the bud. But also, you've exported this program outside the state. Before we get into that, maybe we should go back to the question that we left unanswered at the bottom of the hour. Dr. Rissover asked you about, I believe it was a 14-year-old.
Well, I said 14 or 16-year-old. I have a teenager that comes in that's overweight, and how can I impact on him?
Well, that's an excellent question, because I'm also seeing patients in the Center for Healthy Weight in Columbus at Nationwide Children's Hospital, so I certainly do a lot of medical management every day as well. It's a very delicate topic, as I told you earlier in the program. And if they're coming to you and they're asking you for some advice, that's much easier. If they are not concerned about their own weight or their own health, then you have to really make the interview what we call a patient-centered interview, which means you need to try to elicit their feelings about their weight to start out with. So I would tell you that the most important thing is to counsel on health. It doesn't matter what the number on the scale reads. It really has to do with good, healthy nutrition, physical activities, good night's sleep, and really self-esteem and how you feel about your own self-image. So we spend a lot of time just addressing the health issues that are related to the weight. So that's the better way to approach it. So if this particular teenager has a significant family history of heart disease or type 2 diabetes or hypertension. In fact, I typically find that most of the kids know somebody who has type 2 diabetes in their family or an extended relative, and if they had any concept of what that means. So what we're counseling is on health issues. And oftentimes, even the children in the teenage years that are overweight may not have health issues yet, but they're running significant risk for a health issue. I mean, essentially, they're adult diseases that attack the kids at teenage years. So I would at least focus your attention on the health-related risk factors first.
When should a primary care person like a pediatrician or, say, Dr. Rissover in his practice, internal medicine, when should they say, gee, I need some help on this, maybe I should send the patient and the family to see you? And that also, after when you're at the end of that, give us some places where you do evaluate these situations. So that's an option is to get a consult, right, at some point. When should he pull the trigger on this 14-year-old and say, maybe we need to send you to a specialist?
Yeah, that's an excellent question. There are guidelines for pediatricians, family practitioners, nurse practitioners, that there's a tiered strategy for counseling. And we start counseling in the primary care setting, and then it goes up with more complexity. So there are some primary care physicians or healthcare professionals that will ask the family to see a dietitian. That would be considered a higher level of counseling that won't go on in the primary care. Then you go up a tier to a place where I'm working, which is a tertiary care center, which is a hospital-based program. And that's typically for children who have a BMI greater than the 95th percentile. And most often, those children also have a secondary medical concern like diabetes or hypertension, or they've been identified as having a very high cholesterol level. And keep in mind that these things are all considered heart risk. So it's cardiovascular health ultimately that we'll be counseling on. So it's up to the comfort. So to answer your question, it's up to the particular primary care physician as far as their comfort level. If it's something that they would like to start counseling in their office and give it a few months of a trial, then that's wonderful. If the family, or if it's more complicated and there's medical issues that they're not comfortable with, then I think it's very appropriate to refer on.
Is it covered by insurance?
That's also a good question. Fortunately, because of the acknowledgement of how severe the obesity crisis has become, there has been better reimbursement for obesity management. If a person has a medical condition already, then you can always use that as insurance coverage. But we fortunately have been, it's getting much better that the medical community understand the gravity of this problem, and that if we don't address it, the healthcare cost down the line is going to be even more significant.
Do they cover the dietitians too, or nutritionists, or only another physician as far as insurance goes?
Well, there's been some recent changes, and they have been in the primary care setting. There has been better insurance coverage for a dietitian. And again, those things are changing.
What if the family has no insurance? Medicaid, what if they're on Medicaid? Is that covered as well?
Yes. I mean, I see a predominant number of Medicaid patients at the hospital, and yes, they're provided counseling.
Now, generally, when they get to you, you don't ask just to see the patient. You like to see the family, right? Explain how that happens.
Well, I am still a pediatrician, and legally, I'm not typically giving care to anyone who's less than 18 years of age. So all of the children, and this is not just the hospital setting, it's out in the community as well, these children will be accompanied by their parent. But that brings up a very important point, because typically we're really talking about parenting. And that's the beauty of pediatrics, which is probably why I chose it to begin with. And so it's really important for the families to understand that if you single a person out, we see families where one child is thin and the other child is very heavy, and so the parents are trying to treat these kids differently, and in essence, that's not effective. I have seen very thin children that are very unhealthy because their nutritional deficiencies are apparent and their diet is inadequate. So I tell families that this counseling, whether it's prevention or weight management, it's all about the family. It's about the purchasing choices. What do you actually purchase at the grocery store, regardless if you're using food stamps or you're purchasing your food at Trader Joe's or a place that's a little higher end. It comes down to making those purchasing choices, and then when the home is provided in a healthy environment, then the kids will choose within that environment.
Now, sometimes do you put the whole family on a program?
Oh, absolutely. We have a program that we are offering at Nationwide Children's Hospital in the evening, and that's mandatory. It's mandatory that one adult accompanies the child, and we actually have incorporated an athletic trainer with our program, not like an athletic trainer you'll see on television. Nobody's beating them with a stick, but they're very cognizant of the fact that a lot of the overweight children are not physically fit, and so you've got to start where they're at. They do a very good assessment, and we do that as parents as well. Most recently, we even offered the parents a weigh-in, and I would say more than 50% of the parents have agreed to have themselves weighed as well.
Jay, you got a question?
Yeah, actually, you just raise a great point. I mean, many times parents might be overweight. They might have overweight children, though certainly that's not necessarily true, but you certainly see that. Do you sometimes try and engage the whole family, get them to be on the same healthy diet as the kids, right?
Well, that's the ideal circumstance, and that's our premise, that regardless of the age of the child, it's still the parent typically who's purchasing the food, and also the parent who's as a role model. There are some families where nobody's active in the family, so if there's minimal activity by the parents, and obviously the kids are role modeling after what they see as far as parents. So there's no question that we are definitely parent-focused and patient-centered.
Dr. Leslie Dye, our resident toxicologist.
I just wanted, what I've neglected to mention, though, before is when you asked me about tertiary care or intervention, I do want to say that Children's Hospital in Cincinnati does have a program, and they have a center called the Center for Better Health and Nutrition. And they also have a program called HealthWorks, which is geared towards children ages 5 to 19 that are interested in weight management. And that phone number is 513-636-4305. So that's a local program.
Yeah, repeat that.
It's Center for Better Health and Nutrition at Cincinnati Children's Hospital. It's also found on their website. HealthWorks, the phone number is 513-636-4305.
Amy, how often do you see an issue with parents using food as a reward? I mean, I was walking through the Y just yesterday. I actually exercised too. I didn't just walk through. And a parent was telling her, he looked like he was 3 or 4, and said, okay, here are your options. We can either do this or we can go to McDonald's. And you hear that so often, a reward or bribe to kids. If you do this, we'll go for ice cream. I mean, even in the emergency department, the kids come in, they get sutured, or they have that's going to be their reward, is they're going to get a cookie or ice cream. How do you think that has a big impact?
Well, that's a very common practice. I agree with you 100%. What we've tried to do is shift the reward to personal attention. There's a lot of kids that are constantly complaining about being hungry. I'm hungry. I want something to eat. And it's an attention-seeking behavior that's learned over time. So
they're really not hungry, are they?
They're not hungry. And parents have to acknowledge the fact that may be partly just the attention-seeking, and they've had a positive response every time they said they were hungry. Certainly, if you're 2 years old, you're not going to make that person wait 4 hours for food. So it's kind of a learned behavior. But the reward issue is very, very important, because ultimately we're not trying to restrict kids from an occasional candy, an occasional visit to fast food, or a special reward of going out for ice cream. I mean, all this is about moderation. And I hear oftentimes that parents will say that that's the only thing that motivates them. And I'll tell them, well, that's the learned behavior. But if you spend time with your kids, if you say the reward were to a 10-year-old boy, you're going to go outside and play football with dad for 10 minutes. I mean, that's a lot more important, and it's good for both dad and the son. So we're really talking about the difference between everyday foods and those special foods for celebrations. And our focus is really just to make sure that parents understand that we're talking about everyday foods. We're talking about breakfast, lunch, dinner, and then occasional snacks, depending on the age of the child.
When we come back, we want to ask you about school lunches. If you'd like to join us, 749-5500, 800-823-TALK, or Dr. Wolf's TakeChargeOfYourHealth.com. This is Take Charge of Your Health, 55 KRC, the talk station. And welcome back to Take Charge of Your Health. This is Dr. Wolf, your host, and we have in the studio Dr. Amy Sternstein, Professor of Pediatrics at Ohio State University, and we're talking about childhood obesity. When we left for the break, we wanted to talk a little bit about school lunches. And Travis, you got a question?
Yeah, this is about school lunches. I just want to know, as a high school student, that's something I eat every day. And I want to know how unhealthy these school lunches are that they provide to all the students, and whether or not it's really necessary or it's a better choice to pack your lunch every day.
Well, you're not alone in that question, because in January of 2011, the USDA revised the school lunch program. And the schools are expected to implement this change starting in January 2012. So every parent can ask for a school menu for the lunch menu, and the new revised requirements are very specific. So to answer your question, the school meals are getting more nutritious. They have cut down on the calories. For the first time, they actually have a maximum calorie count. They used to just have a minimum based on the USDA. They are serving fruits and vegetables daily. They are encouraging whole grains. They're decreasing the amount of sugar, fat, and sodium, which is salt, that's in the diet. So there's some really good changes. So as a parent or a grandparent, you can ask the school for the school menu, and you can make a decision whether you would like to pack the child's lunch or wait and have them eat in the school cafeteria, because the kids usually know exactly what they want. Now, that being said, we also have free and reduced lunch programs for a very significant part of the population in Ohio, and the schools are now providing, as well as lunch, they're providing breakfast. So in the schools now, there are lots of kids that are eating actually 2 out of their 3 meals a day in the school. So it's very encouraging for me to know that the school is becoming very disciplined in that they're changing their nutritional ingredients.
Now, is this for schools all across Ohio, Amy?
Yes. Well, this is at the USDA is a federal.
So across the country.
Is a federal, but it does not apply to private schools. So it's typically in the public school education. There's also, I just want to mention this because this has also been some controversy. And for those of you who are familiar with Jamie Oliver, who has been to several schools, he's originally from England, but he's been in several schools trying to revamp some of the school lunches. There's been debate about milk in schools because typically schools are serving flavored milk. Well, I'm also pleased to announce that very recently, the schools have changed to fat-free and low-fat flavored milk. So now if you look at the comparison of white milk, plain milk, low-fat, and flavored milk, there's a less significant calorie difference than there used to be in the past. Kids do prefer to drink flavored milk. And, of course, the calcium is important. The vitamin D is important. So if it's a choice, this is a personal opinion I'm giving now. This is not a dietitian's opinion. But if I would rather have them drink flavored milk that's lower in calories than it used to be versus not drinking milk at all.
Is this primarily chocolate milk?
Yes, but believe it or not, there's still a strawberry milk contingent out there.
I never could drink that strawberry milk. I mean, you got to draw the line somewhere.
Amy, isn't it also true that drinking low-fat milk is just as good for kids? Is there an age cutoff where it's okay to drink 2% versus whole milk, and either one's fine?
Traditionally, whole milk has been provided to children until their second birthday, and that's a clear recommendation that comes from the American Academy of Pediatrics. There's been just discussion about if you do see a child who's not quite 2 years of age but is still drinking whole milk, can you actually decrease them and wean them slowly to a lower fat product? And that's really a preference or a decision that should be discussed with your primary caregiver or your pediatrician. But what is important is that whole milk, low-fat milk, skim milk, or fat-free milk, they all have vitamin D and they all have calcium. So oftentimes people consider, though, they'll say it's vitamin D milk, and they're referring to whole milk. But vitamin D, in fact, is also in low-fat milk as well as skim or fat-free. So the nutrient content is exactly the same. The only thing that's different is the fat content.
A question.
What's a good kind of basic lunch to pack that's healthy and balanced instead of buying lunch?
Well, we always talk about the good old 5 food groups. And in third grade, typically in the curriculum in school, they mention the 5 food groups. And basically, it's the dairy, it's
Snickers.
protein,
Milk duds,
fruits and vegetables, and some kind of starch or grain. So, I mean, you can easily have a sandwich with whole grain and stick a piece of lettuce or tomato on. You've got some vegetable there. Typically, you pack some fruit, and some people have a glass of milk. There you go. And your protein source could be your peanut butter on your sandwich. It could be some lunch meat on your sandwich. But it's pretty easy to pack a lunch that actually incorporates all of those 5 food groups.
Amy, one thing that I've noticed from being in your house, actually, is I think having the access to good food is so important, and not having access to bad food. I think that sometimes eating healthy takes a little more time and planning, so that you peel the vegetables or you wash the fruit and cut it up, and have that sitting on the counter, which takes more time and effort. But I think that's an important point and something parents can do to help their kids.
Well, we now live in a society where convenience is everything. So when you're starving and you're coming home from school, you're going to pick up the first thing you see. So it does make sense to offer the healthier foods quickly, because oftentimes they're not even thinking about what they're choosing. They're just looking for what's most readily available. So I think that you make a very good point there.
Could you repeat where our listeners can get more information? You mentioned a website earlier. You mentioned a phone number, if you still have that for the local area, Children's Hospital. You still have that?
Yes, I do. I do want to mention another resource for all of you who are parents of school-age children or grandparents of school-age children. There's a wonderful organization that I'm on the board on as well, and it's called Ohio Action for Healthy Kids. And they're doing a lot of wonderful programs. I'm going to speak to a PTA group in about a few weeks. They have a program called Healthy Children, Healthy Schools, and their website is www.actionforhealthykids.org. So that's an excellent reference. We also have information on the actually our website in Columbus, www.nationwidechildrens.org/healthyweight. And then the third was the local contact, which is Cincinnati Children's Hospital, and that website is www.cincinnatichildrens.org. And that phone number again for the Center for Better Health and Nutrition is 513-636-4305.
So the big picture is if you think as a parent or grandparent that something's not quite right, that maybe a child is overweight, you could ask the primary care person to run them through the numbers and see where they are. They may make some recommendations. If that doesn't work, there are other steps that can be taken to help the patient as well as the family.
Right. Well, before we close tonight, I just really want to say that this doesn't have to be hard work. And I tell kids this is not punishment. This is something that is good for your health overall, good for your self-esteem, good for your self-image. So they're basic. Breakfast is important. Fruits and vegetables daily is important. Portion size is important. Family meals are critically important. When kids eat together with their families, that's really good quality time. Limiting all the sweetened drinks are important, and sleep. I just want to say sleep is important as well.
Thanks, Amy. Thanks, Jay.
Yes.
Leslie, Bill, Denise, for joining us. Next week, it's National Thyroid Awareness Month, and we're going to feature Dr. Tom Pretorius next month on thyroid. So, yeah, palpate your thyroid and listen to us next week. Until then, take charge of your health. Take care of yourself. Doctor's orders. 55 KRC, the talk station.